Hi, my name is Vu Lee, and yeah, I went to ACC, um,
Oh, okay.
and I finished nuclear medicine school in 1999.
Oh, wow.
Yeah, so I go direct to nuclear medicine.
Nuclear medicine.
Yeah, yeah. So I don't have X-ray or anything else.
Oh, okay, okay. So why'd you decide to go into nuclear medicine?
Well, that time I don't know. I just picked NUMED.
You just.
Yeah, I just picked NUMED.
Okay, okay,
Yeah.
okay. Was it what you expected when you got into it?
Yeah.
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 Okay. Was the school hard, difficult?
No, not really. So that time is easy to get in because now a lot of people apply for that program.
Yeah.
But now I think it's hard. A lot of people apply for it, so they pick very limited number.
Limited number.
Yeah.
Okay,
Yeah.
okay, gotcha. And you think education has changed now, or is it still the same?
I think now they a little bit change. They might demand more knowledge, and
More
so
knowledge.
because every day, it's a little different than the old
Advances in
days. Yeah, because
technology and
I've
stuff.
been doing it for 20. I went to school like 1997, so it's been about what 20,
21 years.
5 years ago. So it's
Right.
different now. Yeah.
Oh, okay.
Yeah.
Gotcha. If you could list some pros and cons about your job, what you like, what you don't really like about it.
For nuclear medicine, I like it, but you take care of patients, you work with patients, you know, you do a lot. You do IV, you involved with injection,
Okay.
isotope, you involved with doing IVs, you work with nuclear cameras. I think I like it. The only thing that right now I think a lot of people have a hard time to find jobs.
Find jobs right now.
Yeah.
What do you think that is?
The old days, a lot of doctors they do nuclear medicine stress tests in the office.
Yeah.
But the insurance reimburse less or something. So now they don't do a lot.
Okay.
Yeah, and then now I don't know why, because normally over here we used to be very busy, but now so many hospitals and so many outpatient clinics are open, so they split the number of patients somewhere else, so we're not really busy nowadays.
Oh, okay. They're spread out now.
Yeah, yeah.
There's more nuclear. Okay, gotcha.
Yeah.
Was the salary like a major factor?
Oh yeah, salary compared to X-ray
Yeah.
is more than X-ray.
More than X-ray.
Yeah, I think it's under imaging. I think we get paid more than X-ray or MRI or CT. MRI, CT, or NUMED. I don't know which one higher, but I feel like we get little more. Yeah.
Okay, so have you seen the work that X-ray people do?
Yeah,
the workload and stuff.
X-ray people busy, but you just take picture.
Yeah,
but,
right.
But over here you do more than X-ray.
Okay.
Yeah.
Gotcha. So you like your job?
Yeah, I like my job.
Okay, gotcha. So if you could tell me like a major safety concern, like an MRI, the magnet and the metals, and how that could be lethal for the patient.
Oh yeah.
Something like that for nuclear medicine.
For nuclear medicine, because you handle nuclear isotopes. I
Okay.
mean radiation isotopes. So the safety, because you don't want to expose to radiation a lot, because every nuclear medicine procedures you have to give the patient nuclear isotopes.
Okay.
And so you have to wear seal, because when we have syringe seal, so we have to cover the nuclear medicine syringe before you inject the patient. So there are 3 factors that you protect yourself to get radiation is time. The less time you hold the isotope.
Gotcha.
Okay. The distance. When you scan patient, I think you don't stay too close to the patient. Gotcha. Okay. So distance, times, and shielding.
Okay.
Yeah. So those 3, if you know those 3, and you should be safe. You'll be fine.
Okay.
And we wear the film bands and the ring bands. So they monitor monthly, so you know that how much you expose to radiation yearly or monthly.
Gotcha.
And you know what's wrong.
Gotcha. All right. Sounds like similar to X-ray, but you guys handle more radiation.
Oh yeah, we handle
Yeah,
more and more.
for sure. So you need to be more careful in that, I guess.
Yeah.
Okay. And some common pathologies you see on the daily, like for us, we take a lot of chest X-rays all day long. What's some common procedures or?
Nuclear medicine, we do everything. We do like bone scan.
Yeah.
Okay, so we inject the medicine in and we scan the whole body bone 3 hours later after injection because it takes time for medication go to the bone.
Yeah.
So we do total bone scan. We do GI bleeding to rule out the bleeding. You know, either patient have the blood is stool and the doctor want to know where the blood come from. So we do GI bleeding. We do renal scan. They're looking for the kidney functions. So we do renal scan and we do gallbladder. They call HIDA scan. That will take picture of your gallbladder.
Oh, okay.
And they see ejection fraction, how well the gallbladder contracts. We do heart scan. We take picture of the heart. We do nuclear stress. So we take picture the heart before and after stress.
Oh.
We do thyroid uptake and scan. You know, we take picture of the thyroid. We do gastric empty. You know, so they want to see when you when the patient eat.
Yeah.
How long how well the stomach functions.
Okay.
How well the food's been digested. Yeah. So we do gastric empty. We do gallium whole body. We do infection bone scan. We do infection sanitary. We do a lot of stuff
That
here.
sounds like a lot.
Oh yeah. And not only diagnostic, but we do treatment too.
Treatment.
We do treatment like for thyroid cancer.
Oh wow.
We do treatment for bone, what they call Y90 for bone pain.
Bone pain. Oh,
Yeah.
I didn't know that.
So we do a lot.
That's great. Lastly, if you could give any advice to students that are wanting to get into nuclear medicine, any eye openers that you probably didn't think you would have to do that you realized you did, or anything for students?
Well, compared to X-ray and NUMED, I prefer NUMED.
You prefer NUMED?
Yeah, because X-ray and NUMED they're all the same 2 years program.
Yeah.
But NUMED you get pay more.
Pay more.
Yeah. But NUMED normally they do one shift only, daytime only. So you have a hard time find nuclear job.
Yeah.
Then you find X-ray because X-ray they have 3 shifts. They open 24 hour a day.
Right.
So you can find job for X-ray more than easier than for NUMED.
Okay.
But NUMED get paid more.
Yeah.
Than X-ray.
Gotcha.
So it depends on but I still want I like NUMED. Yeah.
Gotcha.
Yeah.
And lastly, your schedule. Could you tell us how your schedule works?
All depend on the facility you work for.
Okay.
Depend on, but sometimes we here the old days we're busy. We open 7 days a week. Yeah, but now the business the volume down, so we do Monday to Friday.
Monday to Friday.
Yeah, and over here we do 4/10, so we work 4 days, 10 hours a day.
A day.
Yeah, so we work from 6. We open from 6 to 5:30.
Okay.
Yeah.
Gotcha. All right. Sounds pretty good. I think that's it for the interview.
Okay. So you do X-ray now? You X-ray student?
Yeah, I'm an X-ray student. Yeah.
So you in college already? First year or second year?
HSC second year.
Oh, second year. So
yeah.
you'll be done next May or what?
In August.
Oh, next August.
August coming up, yeah.
Oh yeah, so another year. Okay.
Yeah,
Okay. So
less.
you go that ACC too, right?
HSC, yeah.
So which one is the campus right here? Which one?
The one in Coleman, the one in Med Center.
Oh, Coleman Med Center.
Yeah.
I think that's the one I went.
Yeah.
Yeah. Okay. Yeah. So when you apply for that program, why you chose X-ray?
Why I choose X-ray? So I was actually.
Do you see the program NUMED over there when you go there?
I did.
You see?
I needed one more class to apply for it, which was special for that program,
Uh-huh.
and I didn't have it at the time, and I was desperate to get into a program.
Oh,
So I got
see.
an X-ray.
Oh, so if you go to new med, you have to finish that course.
Yeah.
But you don't finish that time.
Right.
So you have to go new X-ray.
Right.
I see. But yeah, but here so once you finish X-ray.
Yeah.
And I see a lot of X-ray tech do this. They cross training go to MRI or CT.
Right. Yeah.
And I think that's really good. So
Yeah.
so at that time you can get pay more.
Yeah.
You can do you can do MRI or CT.
Yeah.
And then you can find part-time job somewhere else. You can do X-ray.
Yeah.
So if you really need money and you like to work, so I think that's really good.
Thank you.
Yeah.
I'm
You
considering that.
young and you want to build a family.
Yeah.
You finish X-ray and then you go train for CT or MRI.
Yeah.
I think they go another year or something like that.
Yeah.
Or 6
one more
month
year.
program.
Really.
Yeah.
CT's 6 months.
Yeah.
I'm already 1 year. I think.
Oh yeah, time go fast, and then that time you have more than
Yeah.
modality, then you can do
Yeah.
things.
That's what I've been thinking.
Yeah, because you're too young, you can do it. Yeah, it's not me like I'm 50 and you 20 right now.